So I wanted to do a video on heart symptoms that you may not be aware of, because most people think about heart problems of having chest pain, okay? Or left arm pain or left shoulder pain, or pain in the left jaw, or even cold sweats. So most people know these right here, but they might not be aware of other symptoms, okay, that relate to heart problems. And I'm talking about a deeper problem with the heart that could involve the artery becoming clogged, the heart muscle becoming very rigid and losing its elasticity, or maybe the ventricle, which is the pump, becoming dilated and enlarged, or the entire heart becoming enlarged. So all of those symptoms can create these known symptoms, but let's talk about the ones that very few people make the connection. Number one, chronic coughing while you're laying down, okay? That potentially could be a symptom of an underlying heart problem. Now also realize that this could be a calcium deficiency as well, or some type of weakness within your immune system. It could be a virus. So it's not necessarily always a heart, but it could be, especially if you have the majority of these symptoms right here. Nausea, this could come from a lot of things. It could be your gallbladder, your digestion, your stomach, but it potentially could relate to a cardiovascular situation. Swelling in your lower legs or ankles, especially on the left side, because the heart is on the left side. If you have more swelling on the right side, that potentially could be more liver related. What's happening is the heart is losing its function as a pump, and fluid is backing up in the lower part of the body. Next one is pitting edema, which relates to this right here. So when you press into the lower part of your leg or the ankle, it leaves a dent into the tissue. So that's fluid backing up into the tissues. All right, next thing is fainting, okay? That's one. Lack of energy upon exertion. So you start to exercise and you just don't have the energy. So that could be that you're really, really out of shape, or potentially could be the heart. Next one, heavy legs when you're climbing stairs or going up an incline. Now that could be an adrenal issue as well, or it could be the heart, but realize that the adrenals back up the heart. Also, the other one is just you're out of breath when climbing stairs or going up an incline. That's another common heart symptom. And last one, ascites, okay? That's a situation where you have this protruding belly, which is fluid leaking from the liver, but that fluid in the belly could put a lot of pressure up to the organs and affect the heart. It looks like fat, but it's mainly fluid. And you usually see this scenario with the skinny guy on the beach with a pot belly. That could potentially be ascites. But it could also be fat too, so it's not always that situation. All right, now that you have the complete picture on some symptoms related to the heart, what should you do about it? I think one of the most important tests that you should get is a coronary artery calcification test. There's some other names for it, but this test measures the amount of calcium in the coronary artery around the heart, and it's one of the best predictors of mortality from heart attacks. You want this score to be 0, okay? Some other things and nutrients that I highly recommend. You want to be on vitamin K2. Vitamin K2 keeps the calcium out of the arteries and in the bone where it belongs. And K2 also works with vitamin D3. These two together are a really good combination. The next most important vitamin is vitamin E. I don't recommend getting a typical synthetic vitamin E. Get a high quality combination between tocopherols and tocotrienols. Get the whole thing and start taking that. Vitamin E is one of the most important vitamins for the heart. It'll protect the inside of the arteries from oxidation because it's an antioxidant. And it will also increase the levels of oxygen in the heart muscle tissue, preventing scarring and fibrosis of the heart tissue. It actually helps make your muscles a lot stronger too. So you'll notice when you take it, you're just going to feel stronger. And there's some interesting studies on how this can reduce the symptoms of heart problems, especially angina, which is chest pain. The foods that are high in vitamin E are the leafy greens and nuts and seeds. Number 3, you need to get off carbs immediately. The carbs are clogging the artery and they're creating the problem because it spikes insulin. Not to mention filling your liver with fat, which then puts more pressure on the heart. So you need to be on a healthy keto diet without any question. If you don't know what I'm talking about, I put a link down below on what to do. Number 4, fasting. Vitally important to reduce inflammation and also get into ketosis. So your heart, especially if it's damaged, would prefer ketones as their main fuel source. So when you fast and you get off carbs, you increase ketones. It wouldn't hurt to take some MCT oil, which also will turn into ketones and feed the heart. And also, by the way, it feeds the brain as well. And go for long walks on a kind of a flat surface, because what you want to do is you want to keep your stress low, but you want to get a lot of oxygen into the heart, into the tissues. You can even do hyperbaric oxygen therapy, which is another great thing to infuse these cells with a super amount of oxygen. Because what someone with a damaged heart has is hypoxia, which is a lowered amount of oxygen in the tissues because of damage. If you want more information about this CAC test, I put a link right here.